The main purpose is to duplicate one of the articles chosen, whereas the researchers are interested to apply the sampling technique in the chosen article to handle the data of real research conducted by the researchers. The chosen article is about the application of multi-stage sampling in investigating the frequency of the households to carry out the medical checkup. So, in terms of this, the main research topic for this project is to investigate about the frequency and reasons for Universiti Utara Malaysia UUM students to visit the University Health Center PKU in a specific time frame, which is about 1 year time interval equivalent to 2 semesters. Due to the time constraint and budget problems, the researchers decided to narrow down the scope of research within students from School of Quantitative Sciences SQS instead of all students in UUM. In terms of this, it means that SQS students will represent the UUM students to carry out this research. PKU has always been an issue in a university as it is dealing with students' healthcare and emergency situations in some extreme cases. Students' visiting frequency with the respective perceptions towards PKU facilities and services provided are said to be significant to improve continuously. The researchers applied probability sampling, which is stratified random sampling, together with the aid of interview to obtain more information regarding to PKU. Probability sampling is a sampling technique which is based on probability, whereas each object has the equal chance to be selected as the sample. Probability sampling is said to be more convincing to the readers, and the results are able to be generalized to the whole populations. A set of questionnaire is constructed as a method of survey and to be distributed to a total sample size of n equals to 90 respondents among SQS students. For your information, there are 3 courses in SQS, namely Business Mathematics, Industrial Statistics, and Decision Science. In terms of this, the total respondents for 3 courses will be 90 respondents. The questionnaire design included the basic demographic background of the respondents, frequency of visiting PKU in a 1 year interval time, purpose of visiting PKU, and diagnosis provided by the doctors. Apart from this, face-to-face interview is applicable in this case as respondents might provide detailed perception regarding to the services and facilities provided by PKU. Now, I would like to talk about the significance of the study. As a competitive university, the fields of concern should not only be limited to the academic achievement but also about the facilities and services provided. Not to mention that in this case, UUM is always known as an eminent management university, whereas the facilities and services provided should be the focus and continuous improvement. The significance of this study is about how UUM students, which is in this case taking SQS students as representative, utilize the medical resources and also the perceptions towards University Health Center. The study is important in investigating the current quality level of University Health Center in various fields and contribute continually quality improvement corresponds with the concept of total quality management, TQM. TQM is a very important concept to be applied in management field. It concerns about the continuous improvement of the services and also the productivity that involves all of the relevant authorities. So, statistical concepts should be combined with TQM to continuously improve a facility services. In terms of error, the researchers have encountered several errors in this study. The first is about the error of non-observation, which is not caused by the researcher itself. In terms of this, the researcher has experienced the error of non-response, which is some of the respondents are unable to answer the questionnaire accurately according to their knowledge and experiences. This can be caused by the certain words cannot be understood by the respondents or maybe by the language barrier. To cope with this problem, the researchers are always ready and stand by to explain every term and words used in the questionnaire and also explain about the main concept in the questionnaire. Apart from this, another error is about the error of observation, which is caused by the researcher itself. In this context, it is about the interviewer, because the interviewer are students, so the interviewer might be unexperienced in terms of asking the questions, or maybe the intonation and also the language used or the words that might cause the offense to the interviewees. In the context of methodology, the key concept in this survey method is about the application of probability sampling, which is stratified random sampling. Stratified random sampling is carried out by first dividing population of interest into k mutually exclusive and collectively exhaustive strata or groups, then randomly select the elements from each stratum as sample by using simple random sampling SRS, which is randomly select the element without any form of sequence of pattern. Each stratum should be heterogeneous with each other and the elements within stratum should be homogeneous as possible. This means that each group should be different in characteristic, but all the elements in each stratum should be the same. There are 3 courses in SQS, therefore there will be 3 strata, whereas each stratum denoted by each course in SQS. The researchers aimed to distribute questionnaires to a total sample size of n equals to 90 respondents, which means that each course should have 30 respondents, so in total there will be 90. Proportional allocation is applied to determine the sample size needed from each stratum or course. Proportional allocation is making the proportion of sample members in any stratum the same as the proportion of population members in the stratum. In this context, it is calculated by taking the total number of the course, let's say industrial statistics, divided by the total number of the SQS students multiplied with the sample size needed. In terms of handling questionnaires, the researchers are encouraged to use multiple choice questions, use open-ended questions cautiously, which is in this case asking the perceptions of the students towards the facilities and services provided by the PKU. Avoid leading questions because this may cause misunderstanding for the respondents to give accurate answers. Use suggestive language. The researchers should briefly explain the purpose of conducting such survey before distributing questionnaire to the respondent, so the respondent will be more clear and understand about the main purpose of this research. Researchers should always care about the courtesy and possibly give some incentives such as a pen for respondents who successfully answer the questionnaires. The questionnaire should be saliency, which is related to the respondent themselves, which is in this case the PKU is related with the UUM students. The questionnaire should always be short and simple, so the respondents will be patient to answer all the questions given. Last but not least, the researchers conducted pilot test, which is a pre-test to ensure that the questionnaire is usable and able to extract information accurately from the respondent. In the context of data analysis, there are 3 main methods applied, which is parametric methods, non-parametric methods, and regression analysis. Firstly, the data collected should be carried out the normality test, which is Kolmogorov-Smirnov test, instead of Shapiro-Wilk test, because in this case the sample size is greater than 50. So Kolmogorov-Smirnov test is applied to test for the normality of the data. If the null hypothesis is failed to be rejected, which means that the data are normal, then parametric methods such as the t-test and analysis of variances ANOVA will be applied to test for the frequency and so on. If the null hypothesis is rejected, which means that the data are not normal, non-parametric methods such as the median test and cross-Coriolis test should be applied to test for the median frequency. Regression analysis is employed to study the relationship between the purpose of visiting PKU and the frequency of visiting PKU. In a nutshell, the research conducted is about investigating the frequency and purpose of UUM students in utilizing the University Health Center PKU medical facilities and services provided. The research is done based on survey and interview methods, whereas the survey is conducted by distributing questionnaire after employing probability sampling, which is stratified random sampling. The research is said to be significant as for an eminent University of Management, the relevant authorities should always review the current facilities and services planning by accepting constructive critiques and suggestions so that improvements can be done continually.